It's the trocanter. So lay on your side. I'm going to show you that move. Turn it away from me. So you'll have the greater trocanter. You can tell where it is because you put your hand here and lift up. You can feel, relax your legs. When you lift up, you can feel the bone right there. So then I come with my forearm, get off the bone. Here's the bone. Get off the bone, just press right next to it, straight down. I'm leaning, okay? And then now I'm going to just lift the leg up a little bit. That's it. Just a short little contraction. And then, wow. And I can catch all the attachments coming around. Oh.
Wow.
Different position.
That's nice.
And then I was able to do all that stuff before.
And the side posture is great. This requires feel because, look, if you're not in the right location, right, if you come too far up, I'm right in her iliac crest, or what is this? Yeah, iliac crest, and being around the bone. So it's just a small little window there. And, but forearm is best not to reinforce them. Unless it's a 95-year-old woman who's osteoporotic or something like that, then you would do that. But for the most part, it's this move. So the emphasis is not this. The emphasis is location and leaning into just off the bone. Then slightly lift up. When you lift up, you just go right there. You stretch the muscle further, and you go from all different areas because they're coming in from different areas. Okay. So the greater trocanter, you can tell because when you move your legs like this, you can feel the joint right there.
Everything hooks up.
And so what I'm going to do is I'm going to hold his leg like this, really gently, and then here's the bone. I'm going to go off the bone, right there, and I'm pressing on off the bone, and then I'm just lifting it slightly. Then I move. Compression and traction.
So pregnant clients, this would be awesome.
Compression and everybody. And I'll explain what I'm doing here, right there, and then boom, and then here. So you notice I don't lift as high up.
Right.
The focus is right here. When I lift, there's a traction. See,
The lift creates the traction.
Yeah, it's a slight traction because the two bone landmarks is very close. The more you lift up, the closer it gets. So it's very difficult to do this if you go too high up. So again, if you don't know where it is, you feel with your forearm, oh, there's a joint, come off the bone, and I'm near my elbow because it's a small area. So the compression, and then just lift.
So you're softening.
I don't like to lift it only the knee because when I do that, it's an external rotation.
Yeah.
What I want to do is I want to just do a lateral, just like this, and then straight up. See that? Here, and then.
Yeah, no rotation.
Hear that?
So you're
nice
shortening
move, huh?
the muscle.
Wow, feels
He's
really
grinning,
good.
so yeah.
And I'm actually stretching that muscle now. Right now, I'm stretching it
Yeah.
with my body weight. There's no arm movement at all. Yeah, and then soothe. So
Can you ask them to lift their own leg?
no. That's engaging. You want that to relax.
You want to relax.
So the muscles that are attached to the greater trochanter, the gluteus, the minimus, the piriformis, the gemellus, the whatever, Tom, Dick, and Harry. No, that's not here. Yeah, so there's a good move in a side posture. It requires practice because you cannot overdo this. If you overdo it, you're into the
iliac crest.
iliac crest. Yeah, and it's really close. So practice that.